Our goal across the Veterans Healthcare Administration is to safely move and mobilise all of our veterans to their highest potential and to keep our caregivers safe in the process. In order to do this, we need a common language and a standardised way to determine how much our patients can safely move by themselves and what activities they require physical assistance with. There are three types of movement to consider. First, passive transfer, where the patient needs to be moved without actively participating in the movement. For example, if they're sedated and they must be moved to a special diagnostics table, or if they've had multiple trauma and need to be moved onto an operating table. Secondly, during daily mobility, when the patient is participating in daily activities during hospitalisation, such as getting up for meals, going to the bathroom, performing daily hygiene, etc. In this case, the goal is to stay active and to avoid hospital deconditioning as the patient recovers from their acute illness or injury. And third, during rehabilitation, when the patients are actively trying to increase their independent mobility through a structured exercise and activity program. Begin the mobility screen to see what the patient can do. If the patient has strict bed rest orders or bilateral non-weight bearing orders on their lower extremities, they will automatically be level 1. Ask the patient to try and sit up. The patient can use the bed or the bed rail if they need to, but what you're looking for is that they can sit safely unsupported and they can shake your hand across the middle of their body once they get there. If the starting point is a chair, ask them to sit forwards and stay in that position without resting on the backrest or using their hands for support. If they cannot, then you know they need help even to sit. This patient is level 1 and requires total assistance. If the patient successfully passes step 1, you know they can sit up independently and you advance to the next step. The next question is, can they stand up safely by themselves or do they need help? Before we even ask them to stand, we need to know if they have good strength and movement in their hips, knees and ankles. Trying to stand up when both legs are weak and do not have the movement needed puts the patient at risk for a fall and also puts the caregiver at risk for an injury. Ask the patient if they can stretch out their leg and point their toes. They must be able to almost fully straighten at least one leg to pass this step. If they succeed, you know they have enough strength and movement to go on to the next step. If they are unable, they will remain at level 2 and require moderate assistance. The action of raising the butt cheeks off the surface from sitting to a standing position also requires the gluteus maximus or the buttock muscles. Ask the patient to try and stand, clearing their buttocks from the bed or the chair and holding for 5 seconds. They should be able to stand safely without swaying or faltering for the full 5 seconds. If they are unable, they will remain a level 3. A patient that cannot clear their buttocks from the surface can be considered a low 3 and require a powered device to help them stand up. A patient that can clear their buttocks but is just unsteady and is unable to stand without swaying or faltering, they may require a non-powered device such as a cane, a walker or a stand aid, and these patients can be categorized as a high level 3. You now know that they can sit up and stand up independently. Next, you need to determine if they can walk safely by themselves or if they need help. Ask the patient to march in place and then step forward and back with one foot and then the other. They should be steady and have no loss of balance. If they need an assistive device, they will remain a level 3. If they do not need a device, then they're level 4. So let's just review the levels one more time. Level 1, total assistance. The patient can move in bed, but cannot safely and independently sit up and shake your hand, crossing their body without help. Level 2, moderate assistance. patient has enough strength and balance in their body to sit up and shake your hand, but they cannot completely straighten their knee and point their toes on at least one leg. It is not safe for them to attempt standing without help. Level 3, minimal assistance. The patient has enough strength and movement to attempt standing up. A patient that cannot clear their buttocks from the surface can be considered a low 3 and require a powered device. A patient that can clear their buttocks but is just unsteady and is unable to stand without swaying or faltering, they may require a non-powered device such as a cane, a walker, or a stand aid, and these patients can be categorized as a high level 3. Level 4 is independent. The patient can stand up safely and independently. They can step forward and back steadily without losing balance. If an assistive device such as a walker or a cane is needed, they will remain a level 3. We hope this quick review of the mobility levels has been helpful to determine what your patient is able to do independently and what activities they need assistance with. Please refer to your safe patient handling and mobility training to link the mobility levels with the appropriate safe patient handling equipment to safely accomplish your patient's daily mobility goals.